You might be looking at your face thinking that something feels off, but you can't tell what exactly, or you just hate taking pictures with your back camera because it makes your face look twisted, and it probably is. Asymmetry is not just about one eye looking smaller. Asymmetry is run deeper into the bones, muscles, and they deeply affect the attractiveness and facial expressions. So today I'm giving you the clearest guide on identifying the 4 main types of facial asymmetry. I'm gonna show you what each type looks like, how they happen, and most importantly, how you can start to recognize them in yourself and resolve them. Ever since I started working with people, side bending rotation has been one of the most common patterns. Just imagine the spine and cranium being twisted like a spiral. Okay, so one side of your body feels tight and scrunched while the other feels stretched, relaxed. And you might notice eye and ear on one side are lower on the same side. One cheek may be more compressed and the jaw just swings off of the center, right? And that makes the midline of upper and lower teeth not match. This asymmetry also affects the body, so one shoulder is forward and lower, and people with side bending rotation, they usually have one side of the maxilla that's wider, so they struggle with uneven mewing since their whole structure is crooked, twisted. So even their tongue is twisted to one side. And you can imagine how important symmetrical structure is when it literally affects whether you'll be able to keep the correct tongue posture and achieve your full facial development. This asymmetry often starts from atlas rotation, uneven ribcage expansion, or a dominant chewing side. So either of those can trigger this pattern. It's a full body twist, so in order to fix the root of side bending rotation, spine, pelvis, and the cranial base need to be brought back to center. So we're talking about strengthening the spine, centering pelvis and atlas, and it's also crucial to center the maxilla since it determines the position of each bone on the face. So if maxilla is not centered, then your entire face and body will twist, and that twisting will cause uneven eyes, crooked nose, and other features which are just not attractive. Maxilla can be centered with 3D centering thumb pulling techniques, but before you start with those techniques, it's really important to rule out any other asymmetry that might coexist with this one. The common type to coexist with side bending rotation is lateral strain. This pattern is about shear forces in the skull. Okay, so think of face being pulled sideways, one side being pushed forward and the other side dragged back. So when you look at that face from above, it's shaped as a parallelogram, okay? And the classic sign of lateral strain are one eye bulges, the other is sunken, jaw feels misaligned because of the asymmetrical tension, mostly on one side, right? One ear is often flared out because of the externally rotated temporal bone, the other ear is flat, and one side profile is significantly wider than the other side. This is deeply linked to the sphenoid, and the temporal bone, and bringing them out of external and internal rotation can literally resolve lateral strain completely. External rotation of the temporal bone can be recognized by ear that's flared out, or just entire side of the face may seem wider. I'm gonna demonstrate the technique for centering temporal bones, but before I do, if you enjoyed the video this far, consider liking it so this information can reach and help more people. Alright, so back to temporal bones. To center temporal bones, you apply pressure on the externally rotated side and you just push it in. And at the same time, you anchor down on the mastoid process on the internally rotated temporal bone and you gently pull it out, just like this. Okay, so you just hold like that for 30 seconds to 1 minute, and you might feel one nostril open up, and that's completely normal. You also might feel untwisting in your throat or shoulders. All of those are just indicators that indicators that this technique is working. Now, the most stubborn type of the facial asymmetry is called torsion. This is a rotation that starts right in the skull, like twisting a lid on a jar, okay? So you can recognize torsion by one eye that's higher and more forward, but the ear on that side is lower. One cheekbone is more prominent, smile is often crooked, one nostril is more collapsed, and maxilla is usually internally rotated on one side and externally rotated on the other side. Torsions often relate to the sphenoid-occiput relationship, so those two bones are rotated in opposite directions, and resolving that can get tricky. So torsion needs to be approached from multiple angles at once to be resolved. It's very stubborn pattern, but with the right protocol, it's possible to resolve it completely. And if you have torsion, then by now you probably have other issues in your body, like spine asymmetry, body pain, and that makes it even more important for you to work on untwisting your face, since that will untwist your entire body. It's hard to propose a universal routine for each type since they're so different, and most of you will have a mix of these, like a torsion with a lateral strain or a sidebending rotation that led to vertical distortion, let's say. So it's really important that you identify your asymmetry correctly and fully in order to choose the right techniques that I'm gonna show you. And the easiest way to identify your asymmetry fully is taking one picture with the front camera and a picture with the back camera, and you just go back and forth between those two pictures, because that way the asymmetry is gonna be much more noticeable to you. So you want to identify the side to which your head is tilted. You want to identify the eye that's higher, ear that's higher, your maxillary rotation, so on which side your maxilla is wider, placed higher and more forward, towards which side mandible shifted laterally, okay, so that's usually towards the side which has a better jawline. You also want to see if one ear is more flared out, since that's indicator of external rotation of temporal bone. Also take notice whether one temple is wider and is one side of your face wider. And now that you checked all of those indicators, you can analyze your side profile. So take notice whether one side of your face is wider and whether ear seems to be closer to your cheek on one side. Also feel for any muscle dominance, okay? Try to identify which side is more tense and which side is underused. Usually more tense side is going to be more forward, since muscles or muscle force is what brings the bone forward and rotates the bone. So now it should be much easier for you to correctly identify your asymmetry, and don't panic if you recognize yourself in each type. I've seen really bad cases with complex asymmetries, but I always recommend resolving the most developed strain first, okay? So the one that you have all the or most of the characteristics of. This video is your foundation. You need to identify your asymmetry correctly before my future videos, where I'm going to make step-by-step guides for resolving each type of the asymmetry. It's gonna take a few days for me to create that for you, so make sure you subscribe and stick around. If you want personalized help, feedback or exercises for your asymmetry pattern, that's exactly what we do inside my private community. It's not necessary for you to be in my private community, but just in case you're looking for personalized guidance and full courses on resolving the asymmetry, that's where you can receive that help. All the information that Annika and I are sharing in our community is backed up with studies, books and science, so it's highly effective and it has already helped many people. Thank you so much for watching this video, and I will see you in the next one.